Thank you for the invitation to speak. I help to develop and manage our care information service for people with MND, their families and carers, on behalf of the Motor Neurone Disease Association, covering England, Wales and Northern Ireland. So an end-of-life guide, a challenging subject both in terms of complexity and sensitivity. So why were we so passionate about this development? Between 2011 and 2013, we conducted or we helped to fund independent studies on end-of-life care, and over 500 people with MND were involved in those studies, as well as other family members and carers. So that was a significant platform of feedback, not something we could ignore. And from that, the main result was that people wanted to be better informed about end-of-life decisions in order to be able to plan ahead more effectively. We already had a small pamphlet on end-of-life decisions, but it certainly didn't answer the questions that we were being given. So we knew that we had to bring something together that was more comprehensive. Bite-sized pieces of information are appropriate in many circumstances, particularly about end-of-life, but there didn't seem to be a central resource anywhere that could actually cross-reference all of the different subject areas and talk about the implications of choices on other areas. So that was the idea of what we wanted to achieve. So who is the guide actually for? Well, it's for people with MND. It's not about them, it's not in third person, it's a direct conversation with them to give them back ownership of what is happening and to try and create a sense of control. Nevertheless, of course, the content we hope will be valuable also to families, carers, friends, professionals, and our own staff and volunteers. What did people actually want from a guide about end-of-life decisions? Well, when people with MND feel ready to make those decisions, and that is a huge statement, we recognise how challenging this is. People need to adjust to the shock of diagnosis. Some people may remain in denial throughout the entire pathway. However, when they are ready to ask questions, they want to know what to expect, even if it is sensitive, and they want to know what the available choices and options are, because without those, the third bullet doesn't happen. If they remain without knowledge and there's just confusion, they can't feel in control of that decision-making process. But above all of that, they wanted to feel supported in those very difficult conversations that need to be had with family, friends, and professionals. So what does the guide include? Well, we talk about the benefits of planning ahead and timely decisions, which of course is important with MND. And we also look at how to manage those difficult conversations with practical tips on how to open those conversations with friends, family and children, and also with professionals. We talk about advanced care planning, advanced decisions, the introduction and withdrawal of treatments for MND. We do talk about what will happen when I die, because by giving people facts, you help to reduce the fear. You can't take it away, but you can help to make it easier. We also talk about how to put personal affairs in order and what to do when someone dies, and that's still a direct conversation with the person with MND. They want to know what the implications of their choices are that they're making now for their families after they've gone. And we also have included for the first time an overview of the law regarding suicide and assisted suicide, and there is a summary at the end of that section which very simply states what the person with MND can and cannot do within the law, what their families can and cannot do to support them, what professionals can and cannot do, and of course what we at the association can and cannot do. Clearly that's applicable to the regions that we're governing, but it does help to clarify in such a difficult arena. Oh, sorry, I think I've gone forward. No. Okay, what does it look like? Okay, well, this is the guide. So it's an A4 piece. You can see it's about 1 centimetre thick, so it's quite a comprehensive piece. We're not expecting people to read it cover to cover. It is a reference piece that they can come back to and tackle in stages. We do have an interactive PDF of this as well, which people can seek out online. And we have all of the different sections within it extracted as separate PDFs, so you can still do that bite-sized introduction if you feel that's more appropriate. It has borders, page borders in different colours for each section, with the titles down the side. You can quickly flick through to find the piece of information that you want. It has quotes included from people with MND or affected by MND to help reduce a sense of isolation, give a sense of shared experience and illustrate the points that we're trying to make. And it has further key points and introductions to directions for information elsewhere. So how was it tested? It was developed by the MND Association with an expert mentor and checked by 6 association teams before it went anywhere else. Then it went to user testing with 9 people who were either living with or affected by MND, so carers or ex-carers. And then it was reviewed by a further panel of 14 qualified professional experts, a whole range of experts from different backgrounds. And even that wasn't enough. At that point, we went out to a further 6 professionals because the panel of 14 experts had certain conflicts which we needed to come to some kind of consensus on. So an example of that would be organ and tissue donation, which is always a very difficult area to cover with MND. And so we went to the Blood and Transplant Authority in the UK, had 2 of their senior consultants look at it individually and then reach a consensus to tell us what our wording should actually be. So very, very carefully reviewed. When is it introduced? Okay. Sensitive content. It should only be supplied when an individual actually requests or agrees to receive the guide, and we've given clear guidance to our volunteers and our regional staff to help them with that. However, should someone with MND have problems with speech and communication or thinking and reasoning, then clearly decision-making and discussions are going to become more difficult. So, any gentle encouragement that can be given is probably an appropriate thing to do. And we have produced a flyer to help people introduce the concept of the guide to families when they begin to ask those relevant questions. So it's a gentle introduction, if you like, and it lets them know exactly what to expect before they order, and it does act as an order form as well. So how is it being used by people with or affected by MND? It made me realise we have to discuss end-of-life options for treatment and withdrawal of treatment more fully. Now, this was from a couple who had their advanced decisions in place, they had their will prepared, they'd looked at lasting power of attorney, decided it wasn't for them, but they understood, and they read the end-of-life guide and went back to their professionals to have further conversations because they started to realise some of the implications of the choices that they'd already made. I found this extremely helpful, especially as a springboard for further discussions with professionals. We're not saying the guide in itself is a solution. No one guide can do that. Everybody's individual requirements are just too varied, but it does provide a platform for those discussions, and it helps to direct them. We've got to talk about how we come to the end of our lives with MND and acknowledge the support available. Otherwise, the end-of-life stage is a very lonely and frightening place. I'm so pleased it has entered the conversation. Anything that we can do to reduce the fear by giving facts has to be an essential publication. Now, if there is no information, the impact isn't just about the moment that the families are in. It's not even about the immediate bereavement that happens after. It can last for years. 30 years ago, when my father was dying from MND, we had no information. My dad suffered more than he should have done, as we all dealt with it as individuals. His death was not a good one and had a negative influence on the rest of our lives. This is now affecting the next generation as well and preventing us from discussing the implications of living in a family with genetic MND. I hope this publication will help other families to avoid our experience. It's absolutely excellent, so I'm sure it will. That was quite a sobering one to receive. So, what about professionals? How are they using it? At the hospice, we have daily discussions with people about end of life, but there was nothing like this guide before, especially for MND. It has all the answers in one concise resource. Excellent. I take this to surgery meetings to encourage GPs, family doctors, to use the guide, and will continue to do so. And that's from a clinical nurse specialist at a hospice. And a hospice, of course, is an organisation or a place that is dealing with end-of-life decisions on a daily basis. And this from an occupational therapist. We met someone today whose MND diagnosis meant their world had ended. As professionals, it's important to be open about death, but it's so difficult, because of course it is difficult for professionals too. We have to recognise that. Yet once they started asking questions, having a physical guide helped us all to focus. We introduced future planning, but also discussed quality of life, and they started to plan a dream holiday. The guide helps clear concerns so people can think about living too. And I have to say that last line has become my mantra for this guide. The guide helps clear concerns so people can think about living. Don't seem to be able to move on. Okay. It has been produced according to an accreditation. We work with the information standard, which is governed by NHS England. So it goes through quite a rigid process in terms of evidence-based review and peer review, etc. Completely separate to that standard, Dr. Biwi, the National Clinical Director of End-of-Life Care at NHS England, gave us quite a sort of a lengthy piece of feedback, but this is an extract. And she said that she felt it was a much-needed guide that will act as a bridge between families affected by MND and the health and social care professionals who support them. It discusses complex decisions using honest and straightforward language. And take-home messages, really. First and foremost, you can help by ensuring that people with or affected by MND have opportunities to discuss end-of-life decisions. You can also help by using this guide in England, Wales, or Northern Ireland, which of course is the area that it covers, or by encouraging similar developments in your region to support and direct end-of-life conversations. And you can view the guide at www.mndassociation.org/EOL guide. And we also have a helpline, MND Connect, and the number for professionals is 01604 611 870, or you can email mndconnect@mndassociation.org. And that's it. Thank you.
Thanks, Kaye. It's great. Any questions? Oh, don't disappoint me. Kaye, end-of-life decision-making, clearly a cultural issue are the barriers to where you can have that discussion, where you can't. And we heard from Bernie this morning that Ireland has issues about having enforceable patient decisions. Australia has a range of legislations that support the rejection or removal of unwanted treatments. How can we take such great work as you've done and start educating other places in the world where patients' rights are perhaps subsumed by other people's ideas of what's lawful and what should happen?
I think that's why it's so important that it is actually adapted to meet the cultural expectations of the region that you're in, because clearly we've only been able to write this for England, Wales and Northern Ireland, and it was challenging in the extreme to ensure that we were doing the right thing even across those three regions. So yes, you're absolutely right. Anything of this nature has to then be taken and made applicable and relevant and trustworthy for the country that you're in. What I think maybe you can take is, hopefully, if we've done our work correctly, an idea from the structure, the way in which we've cross-referenced the different areas of end-of-life care, decision-making, the needs of the families, and looked at how one thing might be implicated along the line somewhere else. And I think it's the nature of what we've tried to do, perhaps, that might be useful to people, not necessarily the specific data that's in the book.
Question in the front.
Jes Rabeck from Denmark. I think we have also a guide like yours, but we can read yours, you can't read ours, because it's in Danish. And the most here, we always hear about the English way, because everybody can read your things, and all who's coming up today, they are coming from England or things like that. But if you read, I think we will also translate ours so you can see what we are writing. Because I think we had the same discussion as you have had about which time are we going to inform our patients about end of life. And I can say that we are coming to the point that that's one of the only things that we know about when we are born, that end of life.
Yes.
So you can start just as early as you, because nowadays when people know they have ALS or MND, they are going on the net. And I think it's much better to have good information instead of what informations there are about a lot of crap. So I think just give it as early as possible, because then you have the good information.
Yes,
Thank you.
I would agree.
Any other questions? I'm going to go again then. One of the problems that we have in Australia and in Victoria in particular is that whilst everyone talks about the need of advanced decision making, and the classic line is it's everybody's business, but it's no one's responsibility. And I wonder how we take the business of needing to get people to talk about and document their advanced decision plans when we don't actually give responsibility to somebody to help a person do that and document it. And I wonder whether documentation of advanced care plan is part of the program that you're running.
We certainly go into that, absolutely. And I guess that's something that would change from country to country anyway. We would refer people to their wider health and social care team for advice, but to specialist palliative care teams or professionals for that specific guidance on the actual form filling, if you like, for advanced decisions or things of that nature. I think that you've still got to get over the first barrier of getting people to actually talk about these things, and that's really where this particular tool comes into its own. I think just by placing this onto a table, it starts to give people around that table permission to speak. It opens the conversation, and that actually is the first part before you even start to fill in forms, is to actually understand the implications of what those forms mean, what the decisions mean, so that people can make decisions that are right and suitable for them. But certainly, I would say that if you can, depending on the setup that you have in your own country, if you can direct people to those that have that specialist palliative care training to assist with those forms, that's probably the wisest course of action.
Thank you for your presentation. My name is Diet van Dorser. I'm from the Hoogstraat Revalidatie Utrecht in the Netherlands. In response to your questions, whose responsibility is it to start talking about these questions, I may add to the forum that it's my job as a spiritual and moral counselor in this team to speak to the people who have just been diagnosed from the beginning, just a few weeks after the diagnosis, to get to know them, they get to know me, and to try to get the threshold as low as possible, and that they will feel that it's an independent spokesperson and that they can use as a partner in this discussion. And the basis of this is from the human rights as we see it, and it has to do with freedom of thought, freedom of religion. So it's a special place in the team, very independent and open and available at all times to the MND patients. That's what I wanted to add. Thank you.
Thank you.
Thank you. I think
time for one last question after your response.
I was going to say, yeah, that's quite interesting to hear that. And I think it is, in terms of just talking about end-of-life decisions, it is the responsibility of every professional, because not every team will necessarily have that facility. And somebody who wants to talk about their end-of-life decisions may feel more comfortable with their occupational therapist than they do with their palliative care consultant. They may want to have those conversations with that person, or at least ask certain questions of that person. So I think everybody within a multidisciplinary team has to be at least aware that they could be asked those questions, and be prepared to actually answer them.
One last question? No. Can I just add that, you know, advanced care planning and end-of-life decision-making actually doesn't start when you're unwell or approaching death. It can start at any time. And 50% of Australians die without a will. And if there is one thing that is an advanced care plan or an end-of-life decision-making
Yes.
process, it's actually writing a will so that what happens to your assets and how people that depend on you are looked after. So I think we've got a long way to go yet, and this is a great step forward. So thank you very much.
Thank you.